Good morning.
Good morning. Right? Yes. Test will keep uh next Saturday. Next Saturday will be the test.
Okay, sir.
Today's topic is like my favorite topic because this is like a marvel of biological science. When I first learned this fetal circulation, I thought, matlab, how is it functioning? How is it really occurring? Means who thought of it? And this is the entire process. It is completely automatic. So it consists of biology, it consists of chemistry, it consists of engineering, it consists of hemodynamics, pressure systems,
Physics.
everything combined in one. And then it is happening automatically. There are few topics. One is this fetal circulation. Second is when we learn functions of the brain. Third is the delivery of the baby. I mean, these are some of the most fantastic topics. It's how the baby is knowing, means rotation and this, that, everything. And the immune system. That is once again a superb topic. It is like a commando operation, a covert operation. So first line of defense, second line of defense, then there are few messengers, they go back, they inform that no, we won't be able to send the backup team. So then the backup team is sent. And then there is the intel team. So they intelligently understand that what type of attack it is. And they send the data back. It is stored into the servers of the body. Right? Next time when the attack comes, so it is retrieved. And then accordingly, again the team is sent, but this time this is a reinforcement team and not the backup team because it is specialized. That's how the immune system, that is mRNA, rRNA, T lymphocytes, B lymphocytes, right? Everyone functions. So it's like a story. So when we'll be learning immunity, they say that it is very difficult. No, it is wonderful story. There are multiple agents. So when we'll be learning it, it will be like, say, our raw agents, then agents of Mossad, right? And then obviously the Pakistani agents, how the attack occurs, and how that attack is neutralized. Because it would be the foundation of antibiotics. That is at what point those antibiotics they come into picture. So exactly like our all operations. So when the ground team is over there, but that ground team is not sufficient, right? They are getting the defeat, and then there is an air support. Same way, same way. They come into picture only when needed.
Good morning, sir.
Good morning. And by the way, by the end of today's session, I want to give you one homework. I wanted to give you that homework about 2, 3 sessions back, but I missed it. It is something which is very important. Very, very important. So if I miss, just remind me. And 1, 2, is the third person also there? Yeah, yeah, she's. In last 24 hours or slightly more than that, I would given detailed reply to 3 people. Just remember that homework is basically for you 3 guys. And for others, it's like, I'm not going to take anyone's name, but really thankful to all 3 of you. Right? Those who have And never worry about that if you are writing a very long email. But you have opened your heart, something which you have not told to your parents, and then you told it to me. And that's what I said, that अपना तो क्या मतलब क्या पहचानते हैं एक दूसरे को, just few hours, but still you said that thing in so much of detail, and it's like an honor. So thank you so much. So I tried my best to reply to you, and given phone number to all three of you. And don't worry about, you can send message at any point. As I found that you are passing through a very critical stage of the life, right? So it is like a make or break. So
Good morning,
today's
sir.
homework, which I'll be giving you, it would be for everyone. What I really want is that none of you should be facing any problem into your life. Right? So that would be a small homework, but that small homework, which might take about 15-20 minutes to finish, but that thought process, it might last for 4, 5, 6, 7, 8 hours. But yes, all of you will be doing it. Then I'll tell you the second part of that homework. Okay, so it's time. Yes, it's time. 3 minutes past 10, and we start. So today's topic is fetal circulation. So many messages. Wait, fatafat. It's fun learning immunity, even fetal circulation. Can I record? Actually, want to record? हाँ कर लो ना इसमें क्या? Wait, let me give you the permissions. कौन है? श्रीराज ना? श्रीराज, are you there? You can record. कर देना.
Yes, sir.
हाँ, कोई problem नहीं. Means, I mean, right now you are traveling?
Yes, sir.
अच्छा, ठीक है. चलो. So here comes our fetal circulation. So this is a vascular system. Let me put that keyboard on one side. So here is the vascular system, right? That's our vascular system. So when we say this would be a combination of physics, chemistry, and biology, something what is happening before birth and something what happens after birth, right? And Arya, if you are there, right, you talked about TOF, tetralogy of Fallot. So this is like, it is part of our course, right? That is what is called as the congenital heart anomalies or abnormalities. So tetralogy of Fallot, pentalogy of Fallot, right? That is also there, pentalogy of Fallot. The base of all these congenital heart anomaly is this. Today, what we'll be learning, right? So we'll be learning the fetal circulation, and then there would be one more session which will be based on the embryology part. So once you know the normal embryology is how the heart is getting formed, how every chamber is formed, what happens when it rotates, what about the arteries, aorta and the pulmonary artery, how they rotate, how they come into that position. Now, what I mean to say is this, that this is the trunk, right? And the aorta goes like this, right? Aorta goes like this. So why they are into this shape? Why it is not that Siddha Sada? It is because of the rotation of those chambers, right? How the walls develop and what really happens to walls once they are formed. So the answer of all these anomalies, it lies into that. Second important thing which we'll be learning, and that would be the pressure shifting. Pressure shifting is that if this is the heart, right? If this is the heart. So right now, in adult heart, this is the right side, this is the left side. Right side pulmonary trunk, when it goes out, it has to go how much? It has to just go 6 inches, right? On both the sides. And then the lungs are there, but its function is over. So this right ventricle is never that powerful. But bichara, this left ventricle, he has to push the blood all the way from top to bottom. Right? That's the reason that aorta is so big, so tough. And it has to push the blood up. It has to push the blood down. So that's why this left ventricle system or the left side is high pressure chamber, right? Because it has to, and the muscles are big, so it when it compresses, it generates more power. So this is a high pressure system. Right ventricle or the right side of the heart is a low pressure system because it has to just send the blood to the lungs. But when there is hole, जब कहते हैं ना कि heart में hole है, now medically speaking, you'll find that the hole in the heart, it can be at any place. It can be between right atrium and left atrium. It can be between right ventricle and left ventricle. And the concept changes. Everything changes. But then one thing is very clear that left atrium is also under high pressure. So blood will go from left side to right side. Even over here, left ventricle to right ventricle. This is what is called as the left to right shunt. Right? Just keep this thing in mind. This is for the adult. But when it comes to kid, or not kid, the fetus, all the dynamics would change. So that's the reason that when we talk about heart, it is like a finished product after birth. But before birth, all these marvels will be occurring. So congenital heart anomalies or the abnormalities plus embryology, that is the foundation of entire cardiology. Entire cardiology. If you want to become a cardiologist, whether cardio-physician or cardiothoracic surgeon, right, these concepts, they will be very vital. Also, these are vital for any of the competitive exam, also very vital for any of the Viva. Right? So there'll be 4 keywords. These 4 things you will remember and you'll be able to understand everything, right? So we'll summarize the whole concept by the end of our today's session. So everything is lying in 4 words only. So here we start. So this is the thing. This is the normal circuit, right? We'll now onwards, we'll call it a circuit. So here is the oxygen. Oxygen picked up by lungs. From lungs, it will go to left atrium, right? Because of the pulmonary vein. Right? So from left atrium, it will go to left ventricle via the mitral valve, right? Over here, there would be the mitral valve. From mitral valve to left ventricle via aortic valve, it will go to aorta. And from aorta, it will divide into arteries and arterioles, and then the capillaries, and finally, it will be supplying oxygen to the blood. Oxygen used, carbon dioxide released, and then venules, they'll tributaries, they'll combine to form veins. All these veins will combine to form superior vena cava if it is from head and neck and brain, and inferior vena cava when it is from abdo-pelvis and the lower limb. Then in right atrium, both of them, they will open via tricuspid valve. It will go to right ventricle, and via pulmonary valve through the pulmonary trunk, it will go to the lungs. And this is what is called as the cardiac cycle, because we have already discussed it, so I took it a bit fast, right? But when it comes to baby said, my lungs are on vacation, because the entire baby is in a fluid, right? Baby is in a fluid. The baby is floating. So there is no possibility that the lungs can function. So no lungs. No lungs. That's what happens in fetus. And see now what happens. So here is a mother, right? That loving mother. And this is that bacha. Connectivity is this placenta. Placenta is like a bridge, right? It's like a bridge. Baby tells that, dekho mom, whatever, but I am a selfish bacha, right? So you eat well because I'm going to extract for my growth, right? So mother says lovingly, no problem, chalo, let's form the connection. So here is placenta, right? Placenta. This is a junction. Oxygen goes, right? Oxygen goes to the placenta, and via placenta, it goes to the baby. What baby will do? Baby will return, okay, this is carbon dioxide, and then this carbon dioxide is returned, right? These are the channels. from the perspective of, right, from the perspective of baby, this is the umbilical cord. Umbilical cord, which is connected, right? This placenta is where? Placenta is into the uterus. So if this is the uterus, right? If this is the uterus, placenta will be embedded like this. Just a minute. These mysteries, they talk so loudly. Just one. Sure. So this is the uterus, and the placenta is like embedded into the uterus. And from here, it is the umbilical cord, and that's the baby, right? Which is connected. So that's how it is getting formed. So this is the area in which we'll be interested. That is the umbilical cord. Okay. So one more concept, that is before birth, right? Oxygen that would be supplied by the mother. After birth, there would be independent breathing. And that breathing starts with the first cry. When the baby cries for the first time, and right, that is when the air gushes into those lungs. Lungs pop, right? They start opening up, and then the circulation starts, right? The entire breathing starts, that independent breathing. But till that point, lungs are useless, right? Lungs are not doing, they just develop, right? Lungs, they will become bigger, they'll develop, but there won't be any air in that. So this is one. Another one important concept which you have to remember, yesterday, I think last time we talked about it, and that was this, that this is the liver, right? That's the spleen, right? You remember this, right? Though this is not drawn, right? Size of liver is much bigger than the spleen, but this is conceptual, right? So from spleen, there goes the splenic artery, right? There goes the, splenic vein, right? That splenic vein, inframesenteric vein and supramesenteric vein, they join together to form portal vein, correct? And it is the portal vein which goes into the liver. What it is carrying? The entire digestive system is connected with the supramesenteric vein and the inframesenteric vein, right? Supramesenteric vein and the inframesenteric vein. So they will be carrying, absorbing the nutrition, right? Which is to be processed. So that would be processed into liver, and then it would be going out into the form of hepatic vein, correct? Hepatic vein.
Yes.
And that hepatic vein will be landing into inferior vena cava, and that's how it goes into the circulation. Supramesenteric artery. See, superior mesenteric artery and the inframesenteric artery, right? They are there. Their function is to give the salary to the intestines. Salary to the intestines. So let's say if this is the intestine, so when the arteries will be going, right, the branch of, let's say, supramesenteric artery, so it will be carrying oxygen. It will give the oxygen to these muscles and smooth muscles and those cells. Ke lo, khao, oxygen khao, and jinda raho. Veins will absorb the contents, right, the digested contents, and those molecules, micromolecules, they'll be carried all the way to the liver for the metabolism, right? So that's why it is the vein. Artery is something which is from heart to the organ, heart to organ. So when it is heart to organ, its function is to give salary, to give, right? So over here also, say for example, if you pick it over here, so even in liver, if you remember, there was portal triad, hepatic artery, portal vein, and the bile duct. So this hepatic artery, that's function is just to give oxygen, right? Give oxygen, and it remains good. Now the fun
Sir, so
part.
artery do not have nutrients, just oxygen.
Arteries do not have
Nutrients.
nutrients. Nutrients, they will be like, yes, it would be having nutrients, but main is oxygen. Because nutrients, see, nutrients will come over here in vena cava. Correct? The
Yes, sir.
nutrients which will come out, right? Now they are into infra vena cava. From infra vena cava, So it will go to right atrium, to right
Right.
ventricle, via lungs, and then it is circulating into the body.
Mm-hmm.
Right. So it goes into circulation, and then every tissue absorbs as per their efficiency, their requirement, and it takes. But oxygen, it is pure oxygen, right? That is to be given to the liver. Acha. So that is hepatic artery. Now
Sir,
comes, huh?
can you repeat the full form of IMV?
Acha. This is superior mesenteric vein, right? And this one is inferior mesenteric vein. Mesentery means it is like a thin covering, right? Our all intestines, they are like floating, right? They are connected with very nice, those mesentery, that is the covering. So that because of that covering, when you do the dissection, if you hold the mesentery like this, so all the intestines, they'll be like this, right? You can lift from them. Similarly, there is omentum, right? So that is called as the policeman. So as soon as you open the abdomen, as soon as you remove the muscles, right? When you open to then that pig, which is having that yellowish fat, right? That is the first omentum, which is hanging right from the stomach. So that is the first line of defense. Okay, so this is clear, right? Splenic vein joins inframesenteric vein, then it joins the supramesenteric vein, and this is the portal vein, which will be going into the liver. So far, so good, but this is for adult.
Sir,
In case of,
sir, in the hepatic artery that is giving oxygen, as the lungs are not efficient, the work will be done by umbilical vein, right?
just hold on, I just increase the volume. Can you repeat?
Yes, sir. The hepatic artery, which is supplying oxygen, in babies it is not efficient, the lungs. So the work will be done by umbilical vein here.
Correct. That's what our next point is.
Yeah.
So right now, let's say we have not talked about this, right? So this was the adult thing. But here is the thing. See, lungs, so they are not working. So this is the placenta. So mother has sent the oxygen packet. That oxygen, which is going into the baby. This is what is called as the umbilical vein. Why vein? Because from this point onwards, we'll be understanding everything with respect to the heart of the baby. Right? With respect to the heart of the baby. Not with respect to the heart of the mother. Right? So for baby, it is like what? For baby, it is like blood is coming. Blood is coming. So we'll name it as umbilical vein. Umbilical vein, right? No confusion. So this is the umbilical vein which is coming. It comes inside via this is the umbilical cord, right? This is the whole tunnel. It is the umbilical cord. Right now we are not complicating it because we'll be adding components one after the other. Very quickly. Yes. That's right. You asked it. Also, last lecture concept of aorta and so what I am unable to understand that last lecture concept about aorta and artery and veins. I mean, can you just unmute and ask this question? It's what exactly you want? Because if this is not clear, so then today's session will be just too difficult for you. Where is the query?
Yes, sir. Last lecture you taught about aorta, that clavin, branchiostoma, and all that I didn't understand.
Aorta, you are clear about, na? It emerges from left ventricle, correct?
Yeah, sir, that is clear, but the things after that were not clear.
So after that aorta, right? Aorta which goes out and it supplies the entire body, right? Up and down, right? And that is
Yes.
how it goes. So this is the aorta, and there would be several branches, right? There would be several branches. The three major branches. One which is called as the brachiocephalic trunk, Second, over here, this is the common carotid artery, and this is the subclavian artery. These are on left side, and over here also, it goes, divides, and this continues. So this is the right common carotid artery, and this is
Vertebral
the
artery.
right subclavian artery. All you need to understand is just one thing, and that is this subclavian group that will be supplying to upper limb and thorax. Okay? This common carotids, they'll be divided into internal carotid and the external carotid. So this external carotid will be supplying to the face, and internal carotid that will be going to the brain. So what you can say over here is head and neck and brain. Right? In fact, I'll be showing you this entire dissection. We have got just one more lecture. Next time we'll be taking the histology, and after that we'll be taking the test, and then we'll be starting with the region, right?
Sir,
Huh?
even vertebral artery is there.
Vertebral artery is also there. That
Left
is
side.
circle of, to form the circle of Willis, right? Both two vertebral arteries, they will join together to form the basilar. So that forms the circle of Willis. So the idea is over here, they will be supplying to head and neck and brain, and this is for the upper limb, right? And then this whole artery, it goes down and it supplies the abdomen, pelvis, and the lower limb. So for time being, even if these name of these vessels, if it is not clear, no worries. We just remember for today's session that it is the aorta which will be supplying oxygen to the entire body. Okay? So here comes, so here comes our umbilical vein. We are calling it vein because this is with respect to the baby's heart. This umbilical vein comes, it enters. Now you can say this is the body, right? This is the body of that fetus. So it enters. As it enters, it divides into, first, so religiously it goes to portal vein, because that's where this umbilical vein, it goes, right? So this umbilical vein, it goes into the portal vein. So that portal vein, and it tells that liver is very important organ, right? Liver is, right now, the liver is on vacation because baby is not eating any of the kachra. In fact, digestive system itself is kuch bhi nahi, right? Baby, मतलब सुनने में बड़ा खतरनाक लगेगा. Baby is swallowing, because me and you, we all did this thing for 9 months, right? So it is whatever is excreted, same thing is swallowed, and that is going into the circulation, because digestive system में है तो कुछ भी नहीं ना, correct? So baby is swallowing that fluid, it is coming out of anal canal. Once again, it is the same circulation which is keep on happening it. But that is what keeps the digestive system proper. So here it is, mother feels liver tissue is important because after birth it has to work. So let me give oxygen to that. So here goes the right umbilical vein. This is right umbilical vein, right? It goes into the liver, and liver utilizes that entire oxygen 100% used, right? Liver says, though I have to survive. And then that carbon dioxide, wala blood, because liver has metabolized everything, is pumped into hepatic vein, and hepatic vein opens into IVC. Or rest of the body will say, boss, so hum kya kare? Right? What shall we do? So he say, okay, no problem. We divide this umbilical vein. So this is the left umbilical vein. This right umbilical vein, it goes directly into the liver, but this left umbilical vein, it bypasses. Its function is it bypasses the liver, and straight away it goes into the inferior vena cava. Now, this is not normally what is happening, right? Normally, it really doesn't occur in case of adults. In adults, though, it is the portal vein which is handling everything. But now, over here, this is the extra duct which is formed. Extra duct, right? Nai duct banai. So this is the duct which is related to veins. So it would be very appropriate to tell it that its name would be ductus venosus. So when we say ductus venosus, तो क्या artery में भी ऐसी कोई duct आएगी? Ductus arteriosus, yes, exactly,
Yes.
there is. There is, right? So otherwise, so we would have called it ductus, bus, but no, there is artery also. So that's why we are calling this as a ductus venosus. So this ductus venosus is pushing that fresh, badhiya oxygen coming all the way from the mother via placenta, and it goes into the circulation, right? So inferior vena cava, from one side, this liver is giving carbon dioxide, right? कि मैंने तो पेट भर के खाना खा लिया. This is the output. ये carbon dioxide low, dumped into inferior vena cava. This is the pure oxygen which is coming. So over here, what happens? It is the mixed blood. Baby has to survive for whole. This fetus has to survive for whole life, for all the 9 months in the mixed blood. That fetus never ever gets the pure blood because this is the blood which is getting mixed. So God said, ke, now this is injustice, right? Ek to bichara develop ho raha hai. So what to do? Chalo, hemoglobin badal do. So that hemoglobin, which is called as the fetal hemoglobin, right? This is called as the fetal hemoglobin. When we'll be discussing the hemoglobin in more detail, right? We'll be talking about this with the molecular level. But just for the time being, understand that fetal hemoglobin has got tremendous affinity for oxygen. Affinity means love, right? It has got tremendous affinity for oxygen. Oxygen dekha nahi ke pakad ke chalo circulation mein, right? While the adult hemoglobin, they are aram se kya, there is no kami, right? Lungs are working, aa raha hai oxygen, right? Here to it will say that the things are in short supply. So every molecule is caught and ke dalo blood mein, right? So this is what really happens. This is how the baby compensates, right? Less oxygen, but no worries, it grows. From here, journey starts. So this is the inferior vena cava. From inferior vena cava, as we know, that it lands into the right atrium, right? Meantime, this is the story. This is the story what is happening at the level of IVC. What happens to SVC? SVC में कुछ नहीं. Head and neck ने बिंदास use किया oxygen. Brain ने use किया. They dumped. Upper limb ने use किया. They dumped everything into the superior vena cava. Superior vena cava rich with carbon dioxide और ये जाके डाला सब ने right atrium में. So right atrium is now बिचारा with so much of carbon dioxide, but that थोड़ा सा oxygen. Lots of carbon dioxide, but there is oxygen, right? But thanks to this hemoglobin F, fetal hemoglobin, so it tells que no problem. My duty is to rotate this oxygen to keep everyone alive. From right atrium, as such, यहाँ पे which valve? This is the tricuspid valve.
Tricuspid.
Right, tricuspid valve. So we are supposed to send the blood to right ventricle. ठीक है? Right ventricle, तो right ventricle से मैं क्या करूं? The lungs are full with fluid. Full with fluid. If it is filled full with fluid, no air is going inside. So right ventricle would say that even if I send the blood over there, what would that blood do? Kuch nahi. Blood is to be oxygenated when lungs are not functioning. So this is a useless thing, right? There comes something which is still more interesting. So this was, now we are into the right ventricle. So here it is, right? Just the concept. Superior vena cava, inferior vena cava. Inferior vena cava is giving oxygen. Superior vena cava, it is giving just carbon dioxide. It is the mixed blood which is reaching over here. And then if it goes, right, if it goes via, this is the tricuspid valve, goes into the right ventricle. From right ventricle, it has to go to pulmonary trunk. Pulmonary trunk to lungs. Lungs so closed. So that means this circuit is useless. Now, in our body, there is a wonderful mechanism. And that mechanism we'll understand over here, and then we'll go back to that circuit again. For lungs, this is a concept. This is a concept. For lungs, or in fact, this is true for the entire pulmonary system. What we breathe, right? When we breathe, so that oxygen comes in. There is oxygen, carbon dioxide transfer, right? Because the oxygen, there is more oxygen over here. So that oxygen diffuses into the blood, and there is more carbon dioxide over here. So that carbon dioxide diffuses back. right? And there is only that alveoli. These are called as the alveoli. Yeah, alveoli. So alveoli is a functional unit. So this is just a single layer of cells. So gaseous exchange it occurs. Now there is so much of mechanism which we'll be learning into respiratory system. But the thing is, there is gas exchange. So carbon dioxide goes out, we breathe out. And when we breathe in, that is oxygen. It gets mixed into the blood and it is carried. This is what really happens. So here is the alveoli, inside is the alveoli, and then it is covered by the capillaries. But then there is a concept. If there is less oxygen, right? Body tells, why should I waste my blood into these capillaries if there is no oxygen? So if there is no oxygen or less oxygen, this blood supply is reduced. This is what is called as the hypoxic pulmonary vasoconstriction. It means what? Okay, if there is less oxygen, so then there is no logic in sending blood to these capillaries, right? So vasoconstriction, vessels are constricted of pulmonary system. Now remember, this is not the system for systemic. Systemic circulation is what? अपना हाथ जोर से पकड़ो यहाँ पे, you'll find that immediately the moment the blood won't reach to these areas, all the blood vessels, they will start becoming prominent. There will be vasodilation. So in case of systemic circulation, if there is no oxygen, so those tissues would cry. They'll say, open the vessels. Jitna bhi thoda bhi blood aa raha hai, let it come and we'll be using the oxygen from it. But when it comes to pulmonary, this is ulta. Am I clear in this? Because this is the foundation. This is the foundation
Yes, sir.
for the entire body. Right? When we'll be learning inflammation, this, that, sab pura mein yahi cheez aayegi. And this hypoxic pulmonary vasoconstriction, abhi to it is natural, na? Because lungs are filled into fluid. Same thing happens. Same thing happens when there is some pathology. If the oxygen is not going, they are besharam. They'll say, "Arey boss, mar jayega wo." I don't care, right? This is the thing which is programmed into my tissues. If no oxygen, blood vessels would shrink, right? There would be consolidation. There would be consolidation. कुछ नहीं, tissues ऐसे constrict हो गए. They'll say कि oxygen ही नहीं है तो क्या कर? That's the reason that in some of the cases, say for example, massive myocardial infarction, or when the baby is going into hypoxia after birth, you have to give what is called as the hyperbaric oxygen. Hyperbaric oxygen, I mean, this is something which should be compulsory in every ambulance. Unfortunately, it is not there. Right? When I was in US, we landed helicopter on the that express highway. Entire traffic was stopped because one of the patient, he started sending the signals from his locket. Right, it was an emergency locket, that was a cardiac signal. Helicopter chopper was landed onto the highway, and by the time we reached to MJ Anderson, तब तक तो उसकी एंजियोग्राफी भी हो गई थी. Almost everything was planned straight away within half an hour. तो the stents, they were into his coronary arteries. So the thing is, this is what really happens, because if there is less oxygen, so these tissues, they won't work. They'll say कि जो होना वो हो. अपना principle है, no oxygen, काम नहीं होगा, no circulation.
Sir, is there any physics behind it, like partial
Absolutely, there is
pressure?
a wonderful physics behind it. This is based on receptors. So when we'll be learning the physiology of receptors now, at that point, I'll be able to explain this thing into more detail. That these are the specific receptors. These receptors, बड़ा simple ही है. Receptors means what? आंख बंद करो, अगर जो यहाँ पे किसी ने एकदम delicately touch किया और किसी ने ऐसे touch किया, तो आपको पता कैसे चलो? Because there are two different type of receptors, something for very fine touch and something which is for press, crush, cut, right? All these type of receptors are there. Those receptors, they'll be taking the signals and will be sending to the brain. Brain would analyze, it will say, अच्छा ये किसने message भेजा? It is exactly like khabri, right? Right, in these all covert operation, right? कि खबरी ने भेजा, right? This message has come from the port. That means कि वहां से ये message, if this is the message, that means this is what is to be done. Same thing. So there are tracks, right? All the way there are tracks. The spinal cord is like a complete electronic circuit. Brain is a command center. So there it analyzes, this is a message. It is a strong message, right? So how will it find it is a strong message? From the voltage. From the voltage. So you'll say, yes, the higher the voltage, it has come from these receptors. So that means this is pain. Arre, pain center ko bolo, right? Pain center will say, arre, dard hua. He'll respond कि इडियट क्यों हाथ में रखा हुआ है, राइट? वो जल रहा है, राइट? So immediately it will send to tell to the muscles contract, right? And it will come back. Now at times this goes to brain, but they say कि brain तो यार बहुत slow है, कितनी देर लगाई. So then there are centers into our spinal cord which are called as the reflexes. So what it will do for the safety mechanism, right? The return circuit will be from the spinal cord only. So spinal cord will send the message to take the hand back. So hand is taken back, survived, and then the brain is informed कि ऐसा हुआ था, मैंने decision ले लिया. Brain will say ठीक है, good, I'll remember it, and it is stored. इसीलिए छोटा बच्चा सीधा आग पकड़ता है, पर जब हाथ जला तो अब नहीं करना, right? That is how the brain would learn. So that is the entire mechanism. But this one, hypoxic pulmonary vasoconstriction, it is inborn, hard-coded. It cannot be changed. So pulmonary systems, for any reason, oxygen nahi pahuncha to blood vessels would shrink. Just remember this, because this is the foundation of so many pathologies of respiratory system. Right? So this is true. Now, with our current perspective, what would happen? Lungs ke andar to there is no oxygen. Lungs ke andar oxygen nahi to then lungs, all the blood vessels would shrink. Blood
There are
vessels.
the arteries of lungs in fetus completely collapsed.
Huh? Absolutely. You are 100% right. That's what I was about to tell you. Blood vessels, they are 100% collapsed. Because they follow this principle कि oxygen ही नहीं है तो वहां जाके blood भेज के करना क्या है? Who will be carrying that blood? No one.
Sir, then the first circulation would be too much harsh, right?
No, don't worry. We'll come to that. That's why we have to, मतलब वो बेबी रोए नहीं तो उल्टा करके पीछे खींच के मारो. दिस इज द ओनली इवेंट, सीरियसली, मतलब दिस इज द ओनली टाइम जब ना आपको मार पड़ती है ना, और हॉस्पिटल में आपके पेरेंट्स सब खुश होते हैं, हा, राइट? सब खुश होते हैं कि वाह 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 वाह. फिर तो आप कभी रोते हो तो सब दुखी होते हैं कि बेचारे. बट दैट इज ओनली टाइम when the parents, when अच्छे relatives, doctors, nurses, they are so happy कि हाँ रोया, right? So, और मारा भी बड़ा खींच के जाता है, and bindas, because on buttocks when it is slapped, so it generates strong pain sensations. So पूरा brain के अंदर there is large amount of current goes. So that current, it reverberates and recycles, and when it recycles, जब कोई जोर से मारे तो क्या करते हैं, right? जोर से मारा तो बस. So that's the thing. That's when that air gushes in, and then the baby continues in the form of crying. So again short bursts, because baby को breathe करना तो आता नहीं. So when it cries, so then short burst of air as it goes, and then the lungs pop, right, when they start opening, and then the baby understands कि, oh, now it is my responsibility to breathe.
Sir, where does the lungs fluid go?
Lung fluid, it gets
Yeah,
shifted. It gets shifted.
okay. Outside the area of lungs.
Outside.
Okay.
Yes. Achha. So there is no point in sending the blood to pulmonary trunk. ठीक? So that means this pressure, now this is a high pressure system. अब right ventricle में नहीं भेजना, तो then tricuspid valve will say कि I don't want to send anything. So over here the pressure rises. This is now a high pressure system, right atrium. So for that, there is a gate open, right? This is the gate. There is a gap between right atrium and left atrium, and this gap is wonderful. It is like a one-way door, right? One-way door, and this is called as the foramen ovale. Shape is oval, It is a foramen, it is a hole, right? But that hole is like this flap. Blood will go from right atrium to left atrium because left atrium, there is no pressure, right? Right atrium, because blood cannot go to lungs, that's why pressure is mounting. So blood will be pushed into the left atrium. Left atrium, जिसको किसी ने blood दिया ही नहीं, right? Aya blood, right? It goes to mitral valve, to left ventricle, to aorta, and the blood goes into the, but this, remember, this is a mixed blood, ठीक है ना? This is a mixed blood, but जो भी है oxygen तो है ना? So that oxygen वाला blood that goes to the aorta. Now always, कई बार ना बोलते हैं ना कि यार मत करना, तो भी there are few basic, मैं तो जाके देखता हूँ क्या होता है. So there is small amount of blood who is very smart, over smart, right? They feel कि अच्छा ना क्यों बोला, चल जाके देखते तो हैं. So that blood will trickle into the right ventricle. From right ventricle, it will go to pulmonary trunk, and pulmonary trunk में जाके रोते हैं कि अब तो आगे जगह नहीं, अब क्या करें, right? Blood तो waste, body tells कैसे blood waste नहीं करते, right?
वहां पर भी एक फोरामेन होता है ना?
Duct होती है, duct.
Bypass.
So that duct which is connecting pulmonary trunk, it gets connected to aorta, and that is called as the ductus arteriosus. Ductus arteriosus. Right? Now these ducts, they are all temporary. Yeah? Itna dhyan rakhna. All these ducts which are getting formed, they all are temporary. After birth, they will be all closed. But abhi ke liye, we don't want to waste. So that's why this is the ductus arteriosus. So this is one extra duct formed between pulmonary trunk and the aorta. Now aorta has got the entire blood, whether this super smart blood or apna seedha sada blood. But finally, everything has reached to aorta, and from aorta, it goes to the body. Life is good, right?
The right ventricle contracts.
Right ventricle contracts.
Okay.
Bilkul.
Okay.
Right ventricle would contract. The entire heart is beating. So on ultrasound, you'll be able to see the beating heart. So initially, the heart, if you see, it is like a single chamber, right? Then the septums develop. But वो single chamber भी tuk, right, beat शुरू करती है, and you can actually hear those. If you want to see all these, say I can show you also, right? We'll keep one session. I'll show you. I got the entire sequence, the first beat, right? We have recorded that also. And when the full-fledged heart, complete heart, just before the birth, how it really looks like. It is fantastic. So we talked about this. So situation is now this. Right atrium to right ventricle to pulmonary artery, right? It should really go to lungs, but it is not going. Superior vena cava, inferior vena cava. So that's why the high pressure system has developed into the right atrium. And from right atrium, things have moved to the left atrium. And we are now on aorta. Okay. Just for the sake of our understanding, this is the anatomical position of the pulmonary trunk. Pulmonary trunk looks like this, right? In thorax, we'll be learning anatomy in more detail. But if you are wondering, ductus arteriosus develop kahan se hui? Bahut easy. So this is the pulmonary trunk, right? And here is our all-time great aorta. See, they both are so near to each other. So duct develop hone mein kaun si de? This is the duct. It's just this much small, right? And this duct should not be big. It is not big. It is very small because only that super smart blood, right? Na bola ke mat jao to bhi it has escaped, and that has trickled, and that blood goes into the aorta. So that is the ductus arteriosus. Reason? यहाँ पे रास्ता बंद, यहाँ पे रास्ता बंद, lungs are closed, so there is no other option but to send the blood to aorta. So that blood comes into aorta. Right? So that's the location. That's the location, and this is what is called as the ductus arteriosus, right? There was ductus venosus, and ductus venosus was between which two structures? Fast. Ductus venosus was between,
Liver.
इतना gross नहीं, ऐसे तो body, right? You are always right. Body, human body, nahi. Between which two structures?
Umbilical vein and I was
Left umbilical vein and inferior vena cava.
Inferior
Inferior vena
vena cava.
cava.
Which umbilical vein?
Left umbilical vein and
Left
inferior vena
umbilical
cava.
vein.
Wonderful answer. That is the left umbilical vein and the inferior vena cava, right? So that is the ductus venosus. Ductus venosus. And ductus arteriosus is between two big trunks, pulmonary trunk and the aorta. Great. On to the next one. This ductus arteriosus, this remains open, and now comes the chemistry. Chemistry, that is the prostaglandins. These are the special proteins. So that means in ductus arteriosus, there are receptors. Those receptors, they are not letting it close. So those receptors, they will keep on working. Can I keep the duct open? Keep the duct open. But then there has to be someone telling it. That is the prostaglandin. Prostaglandin kahan se aaya? Placenta se. So mother is sending the prostaglandins also. Ke jaake bol, ductus arteriosus open rakhni hai. Right? So that prostaglandin, which is coming via placenta, is keeping the ductus arteriosus open. Now you can imagine that after delivery, when the placenta is taken out and the cord is cut, so then suddenly ductus arteriosus would say, no prostaglandin. So then those receptors, they would shrink, right? But it is not the instant process. It is a slow process. It would take some time, but yes, that's the reason it shrinks. It gets converted into the ligament, right? And that ligament is something which we'll see when we'll be watching some specimens or ultrasound, right? Or it's sometimes seen in MRI also. So I'll show you that. Right? But
Sir, are they present in adult human?
that's what I'm telling. In adult human, this duct, it gets closed. It gets converted into ligament, right?
Okay.
Ligament. And that ligament is a tough structure. You can see. So you'll see the tissue which is connecting the pulmonary trunk and the aorta. एक मिनट है. हाँ हाँ वहीं पे पड़ा है जी. Sorry. Correct. So that is the ligament.
Sir, same for ductus venosus also.
Yes, same for ductus venosus. For everything. Whatever we are learning right now, everything will be getting reverted to make this normal circulation, right? So we'll come to that. So here it is. We have got the ductus venosus, we have got the ductus arteriosus, and ductus arteriosus, it is handled by prostaglandins. This we have already talked about, that you are the best. Kyun? Because out of 100 million those sperms, right? Out of 100 million sperms, someone who was the best, the finest, strongest, right? It fertilized, and that's you. So ऐसे देखा जाए तो you are winner right from the beginning. So रोना क्यों?
सर लेकिन ऐसे भी नहीं बोल सकते ना, एक डिसाइड करता है ना किसको एंटर करने देना है.
वही तो there is a stiff competition, you know. There is a stiff competition. मतलब this is ओम धम 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 सभी भाग रहे हैं, right? Okay, I'll fertilize. No, but जो सबसे powerful best gold medalist था, he fertilized or she fertilized.
Sir, it's not like a race, right?
It's like a
Like
race.
who
Absolutely. जो
who
मरे
reached
मरे से हैं,
first.
जो मरे मरे ढीले ढाले स्पर्म्स, वो तो ऐसे पीछे रह गए.
Okay, yes.
जिसका न्यूट्रिशन
मतलब
बेस्ट था, वो मोस्ट पावरफुल, they reached, and amongst those few, because 90% तो they got destroyed into the into the uterus only, into the fallopian tubes only, वहीं पे खत्म हो गए सब. because of the change in the pH value. So they were unable to sustain that. So 90% they got destroyed within few minutes. So that's why the one who fertilized, that's the reason, is the strongest, is the best, is the most powerful. And that's you. Okay. Now we move on to the aorta. Aorta, which is generously giving blood supply to everyone. Now that aorta, as it goes down, right? As it goes down, so यहाँ पे देखा था ना, right? This is the thoracic aorta. Then it goes down, that is the abdominal aorta. This is the thoracic, in between there is a diaphragm, and then this is the abdominal aorta. That abdominal aorta, it comes down. So this is the abdominal aorta, right? It comes down, it divides into two parts. This is a normal anatomy. It divides into common iliac artery, right? This is the common iliac artery. Name iliac because over here, this is the region of pelvis, right? The ilium ischium pubis. So ilium is the bigger bone, right? Where if you just put your hands like this, so then your hands, they will be on the iliac crest. So this is called as the common iliac artery. That common iliac artery divides into two parts, external and internal, right? External iliac artery and internal iliac artery. External, it continues as the femoral artery. Femoral means thighs. And then it goes all the way, divides, and then that goes to the lower limb. Fair enough. This internal iliac, the second division is the internal iliac. This internal iliac, that will go to pelvic region. But right now it will say, see, hold on, right? Some branches they go, but they say that we'll send the blood back to the placenta because now the blood is full of carbon dioxide. So that's why internal iliacs, they go and they go towards the umbilicus, right? They go towards the umbilicus. So this green thing, don't confuse this, right? This is for this side of the artery, right? External iliac. So this will continue as femoral and same like opposite side, right? So from here, now we'll call them artery. Kyun artery? With respect to the baby. So this is artery. So we have got now two arteries. Yes, because we have got right internal iliac and the left internal iliac. Right internal iliac and left internal. So right internal iliac will continue as a right umbilical artery. Left internal iliac will continue as a left umbilical artery. They'll be carrying carbon dioxide and it would be given to placenta. From placenta, it will go to the mother. Right. So situation is now like this. This big boss, right? This big one, which is inside, that is the umbilical vein. And winding around it, right? As a wind karke, there are two umbilical arteries. So remember, there are two umbilical arteries and there is one umbilical vein. And they form a cord, but this cord is very delicate, right? It can break. So in order to protect it, it is covered with a jelly. And that is called as the Wharton's jelly. Wharton's jelly gives flexibility, at the same time it gives protection, right? So that is called as the Wharton's jelly. So that's how the whole cord goes, right? That's why when you take it in your hand, it will be a bit sticky type of thing. It's because of the Wharton's jelly and thick Wharton's jelly. So before birth, this is in a nutshell how the things go. All the way from mother, right? From mother, it goes to placenta. From placenta, it is the umbilical vein. It is one umbilical vein which divides into right and left. Right goes to liver, to hepatic vein, and to IVC. That means by this time, it will be dumping only the carbon dioxide. The oxygen from the mother, it is carried by left umbilical vein. It goes to the IVC, but this is not a normal path. A special duct is prepared and it is called as the ductus venosus. Then from IVC, it will go to right atrium. Meantime, from superior vena cava, SVC, the carbon dioxide from head and neck and brain, it is also put into right atrium. Mixed blood, it tries to go to right ventricle, right? But pressure is high. It will try to go to pulmonary trunk. But because from here, the lungs, they are not functioning, So that's why there is no point. So that's why we have got a bypass, and that is ductus arteriosus, via which it goes into the aorta. Meantime, majority of the blood, right? majority, almost 95% of the blood that goes in via foramen ovale into the left atrium to left ventricle. As such, left ventricle, it connected to aorta, and thus this blood, it moves on to the entire body and it supplies oxygen. In the abdominal aorta, it divides, and finally internal iliac veins, internal iliac arteries, right and left, right? They will continue as the umbilical artery respectively, right and left, and they will go into the placenta. Right? So this is obviously via umbilical cord and placenta, and from placenta it goes to the mother. This is the hemodynamics before birth. Right? So we have got certain important things, and that is, we have got the ductus venosus, we have got foramen ovale, we have got ductus arteriosus, and then the umbilical arteries and the veins. Okay, now here is the time, right? The birth. When the baby is said that birth vacation over, right? बहुत मजे किए, right? Now is the time for some real world, and that's where the baby starts crying. यार अब मुझे काम करना पड़ेगा, right? So baby cries. So that first cry, when the air gushes into the lungs. When the air goes into the lungs, that is the oxygen goes. Over here, those receptors, till this point, all those receptors, they were telling no oxygen, blood vessels shrink. But now the oxygen has come, so immediately they'll say, okay, hypoxic pulmonary vasoconstriction, stop. Do vasodilation, right? All the blood vessels dilate, capillaries dilate, right? All the capillaries will dilate because oxygen is coming, low the oxygen, and आगे बढ़ते जाओ, right? So blood vessels, they will. When this thing happens, what would happen? The pressure is released. Right ventricle, जो अब तक दुखी पड़ा था, right? Now it will say, अरे blood तो is going into lungs, so it will dilate, right? So when pressure is released because of the dilation of blood vessels, so from pulmonary trunk, now it will go into the lungs, right? So right atrium to right ventricle to pulmonary trunk, as everything is dilated, so they will. So pressure in right atrium drops, right? Pressure in right atrium drops. So situation is over here. When the right atrial, right, the pressure, which was high over here previously, but now it is significantly less because this path is open, lungs are open. So over here, when the pressure drops, so then left atrial pressure is now more. So blood will try to go back. But no, this foramen ovale, that was made like this, like a flap. So blood was,
One way path.
yes, exactly, right atrium and left atrium. Whereas it tries to go, return the blood via that, it acts like a valve. It acts like a valve. It will stick over here, right? So the return blood won't be possible. Return blood won't be possible. And this was called as the foramen ovale. But then that foramen ovale, samadhi is made, right? So that is closed. But once upon a time, मतलब history में जब heart must be telling कि हाँ एक बार यहाँ पे foramen ovale था, so there it becomes like a fossa. Fossa means depression, and that is called as fossa ovalis. So in case of adult, there would be a small fossa, and that fossa is कि जब हम पैदा नहीं हुए थे तब यहाँ से blood आता जाता था, right? History. So foramen ovale closes because of pressure difference, because now the pressure is more into the left atrium. And that would be now called as fossa ovalis. So during dissection of right atrium, we'll watch the fossa ovalis. Where would we see the fossa ovalis? Well, fossa ovalis, it would be seen as the interatrial septum, right? No rocket science. This is the interatrial between two atria, and that's the septum. So interatrial septum, we see the fossa ovalis. And when we say ASD, atrial septal defect, that means hole यहाँ पे है. So in that case, अभी तो left में pressure ज़्यादा है. Blood will start moving from here to here. So that would be called as a left to right shunt. So that's why when we'll be learning all those congenital anomalies, we'll be understanding it in two ways. One, left to right shunt, and second, right to left shunt. But interestingly, there is something what is called as the Eisenmenger complex. That is, as the condition starts deteriorating, right, hemodynamically, patient's condition improves. Patient feels, now I am so comfortable. But with just 4 दिन की चांदनी, right? Because after that, the congestion starts and it becomes difficult for the patient to breathe. So that's super interesting, right? It's super interesting that why it really happens, why the condition improves, patient starts breathing happily, and then suddenly he collapses, right? But foundation is this game of foramen ovale, game of pressures, hemodynamics. Okay. Coming back to this, here is our right atrium, 2 right ventricle, 2 pulmonary trunk, 2 lungs, all good, right? Placenta gaya तो prostaglandin गया तो then सीधा call गया ductus arteriosus. Okay, now you are not needed, right? And another important thing what happens is कि अब तक तो blood which was going from where? Blood was going from pulmonary trunk to aorta, na? Correct? Because lungs were closed. So pressure was more on the right side. So blood was going from pulmonary trunk to aorta. Now the aorta is boss. So there is reversal of shunt. So the blood starts going from aorta to pulmonary trunk. But it's okay. Aorta, right, which is as such having oxygen, that oxygenated blood is going back to lungs. But there is no loss. Right? There is no loss. It is like you are traveling, you have got ticket and you got pass, both. Right? So, वही का वही blood वापस जा रहा है, but only in small amount because ductus arteriosus is small. So that's why this is only for some short duration. Why temporary reversal? Because prostaglandin is not like a switch. It is a chemical thing. Chemical processes, they take time, right? So this, in the span of about 4 or 5 days, ductus arteriosus shrinks completely. So for those first 4 or 5 days, there is a temporary reversal of shunt. So if you do the Doppler, so you'll be able to see some flow, but now the flow is reversed, right? This is only when you do it in the initial stages that baby is born and then you are just checking whether there is any abnormality or not. So if there is any temporary reversal of shunt, it is normal, right? For first week, consider it as normal. Don't be alarmed, Kare, blood is coming back. No, it's all good. It is just because of the pressure changes. Now prostaglandin is not there. So that ductus arteriosus has to shrink and it shrinks and it is now ligamentum arteriosum. Or kuch nahi hota, just the entire caliber, right? The duct which was like this, the entire caliber, that caliber is squeezed. So now only there is connective tissue. There is no caliber. There is no duct through which the blood is passing and it gets closed. Some candidates are left out. This is the aorta dividing into common iliac artery and external and internal iliac. So this internal iliac, यहाँ से देखो, say this is the body. These internal iliac, they were going out into the form of left umbilical artery and the right umbilical artery. Placenta एक काट डाला. Right? Now there is no placenta. So this cord, यहाँ से umbilicus से ये जो cord connected थी, that will also shell off, right? वो भी निकल जाती है in few days. So that means this is now a dead end. This is a dead end. So internal iliac, right internal iliac and left internal iliac, they say यार इतनी मेहनत से बनाई थी artery, right? ऐसे थोड़ा waste जाने देंगे. So what they say is कि ये nearest organ bladder है. So just let's apply to urinary bladder. So these vessels, they will be making partial, right? Partial, right? Remember, it is partial. Superior vesical arteries, left superior vesicle and the right superior vesicle. Vesicle means vessel. यहाँ पे तो vessel is urinary bladder, a vessel which is collecting the urine, right? So that's why it is called as a superior vesical artery, left and right. So they will be converted to that. Now, umbilicus, at the umbilicus, the final game, placenta to cut dala. There is no placenta. So that means that from here, the right umbilical vein, right, which was going to the portal vein. And then there was a left umbilical vein, which was going to inferior vena cava. They all are now free because blood in here. There is no blood. So there is no blood. These vessels will they will be converted to again ligament, right? So there is a right umbilical vein. There is a left umbilical vein. Right umbilical vein will be converted to ligament, and that is called as the round ligament of liver, right? That is called as the round ligament of liver. याद रखने के लिए R for R. कभी भी गलती मत करो. Wonderful and favorite question of many of the Vivas, right? Because they say कि इसमें confuse करते हैं, right? Nothing to get confused. R for R. Right umbilical vein will be converted to round ligament of liver. During dissection of the liver, we'll be able to see that round ligament. दिखेगा मस्त. Because these are all big vessels, right? पूरे 9 महीने तक इन्होंने blood supply किया है, right? तो उनकी समाधि जो है, that is very prominent, right? एकदम proper दिखती है. Similarly, this left umbilical vein, that would be called as the ligamentum venosum, right? Which was called as the ductus venosus, right? Ductus venosus, which was between left umbilical vein and the inferior vena cava. So now, again, converted to ligament. So it is called as ligamentum venosum. Thanks to some anatomists, क्या easy नाम दिया, L for L and R for R, right? Must. So no confusion. Done. So this is before birth. क्या था? Foramen ovale, which was between right atrium and left atrium, right? But now these are all samadhi, right? These are all samadhis. Once upon a time, वो history में बोलते हैं ना ऐसा. Fossa ovalis. Ductus arteriosus was between pulmonary trunk and the aorta. Correct. Now it is ligamentum arteriosum, right? Because artery. Umbilical arteries, two umbilical artery, they become superior vesical artery, which will be supplying part of the
Partial.
Correct. And then we have got the umbilical vein, which was dividing into right and the left. Right becomes round ligament, R for R, and L, which was ductus venosus, which was between umbilical vein, that is the left umbilical vein, and the inferior vena cava, now becomes the ligamentum venosum, right? So that's how they get it and done. So you have learned the entire fetal circulation, right? Baby is born and happy.
Sir, could you show the upper slide just once?
Sure. Any doubt? कभी भी कुछ भी कोई भी doubt हो इसमें तो
Sir,
हाँ बोलो.
sir, like the femoral artery supplies the blood to the lower limbs of the baby. So how the upper portion receives the blood?
Which upper portion?
Like the upper limbs and head and neck and all.
See, this is the whole. This is aorta, right? Arch of aorta, ascending aorta, arch of aorta, descending aorta वगैरह. यहाँ पे गिन लो diaphragm. From here, there is a brachiocephalic trunk, which will be going up and going like this. This is right common carotid artery. यहाँ से there is one more artery, vertebral artery. Here, this is left common carotid artery. यहाँ से, this is left subclavian artery. So this much group, right? ये जो vertebral, common carotid, they will be supplying to head, neck, and brain. This will be supplying to upper limb. And as this divides, so it is this portion. यहाँ से जो the branches which will come out, they will be supplying to thorax. यहाँ से they will be emerging, they will be supplying to abdomen. And यहाँ से जो नीचे गए, they will be supplying to lower limb.
Lower limb.
Correct?
Yes,
So,
sir.
so that is how the entire circulation it goes. Yes, anything else?
Sir,
Uh,
I have a doubt. Who is
Hmm.
responsible for closure of ductus venosus? Like prostaglandin is responsible for ductus arteriosus. Who is responsible for ductus venosus?
hemodynamics. See,
Hemodynamics.
see, this is the liver, right? This is the body. This is the umbilicus. This is of the baby, right? When the baby was not born, that is when it was fetus. Fetus is before birth. So the cord was connected. That umbilical vein, which was coming over here, it was dividing into right and left. So this was the right, this was the left, and this left was going into IVC. And this portion, we were calling it as a ductus venosus. But now, it is like there is no blood. Hey, nahi. So there is no blood into these circuits. In these circuits, there is no blood. So when there is no blood, so that they shrink. They shrink instantly, right? Within few hours, so they totally shrink. Because blood in nahi hai na? There is no blood. If the blood is not there, so those vessels, they would shrink. As they shrink, they becomes the duct. So this becomes round ligament. This becomes ligamentum venosus. Clear?
Okay, sir. Thank you.
Sir, what are the parameters of ductus venosus?
Parameters means
Like diameter of the duct or thickness.
what do you expect? And what exactly you want to say, find out from that? What is
I
what
just
is
want to
what is the what is the diameter of aorta?
aorta, I think 1.5 centimeter है.
Which age?
Hmm?
What age?
What?
What age? 1.5 centimeter, right?
Adults.
Is 1.5 centimeter? Your finger is 1 inch. That is 2.5 centimeter. Half of that, such small vessel. Aorta is like a big tube.
Okay.
So that the point is, what I mean to say is, about all these things, now these are all fascinating things. This diameter and that diameter, don't worry much about it. Right? When the time would come when I'll start telling you, because you could have asked that question, that what is the pressure? How much is the pressure? That becomes an interesting thing. Because when we say systolic blood pressure, 120 over 80, right? Or 80 by 120. It is systolic, 80 by 120, diastolic and systolic. The blood pressure. That makes a sense. But what about the pulmonary trunk? Pulmonary trunk, the pressure is very less. So that is when the pressure rises over there into the pulmonary system, that is called as the pulmonary hypertension. Right? Now, this hypertension is totally different as compared to what is called as the systemic hypertension. So just hypertension. Because जो कहते हैं निकारे blood pressure बढ़ गया. From the medical perspective, you would ask कौन सा? Systemic or pulmonary, because no one knows about the pulmonary hypertension. People keep on taking many of the drugs and then that shoots the pulmonary hypertension. Normal यहाँ पे blood pressure लोगे तो वो normal आएगा, because this is the blood pressure which is from right ventricle to the lungs. ये in between ये pressure. So when this pressure increases, what it will do? It will push the blood into the lungs. Now lungs, they are very delicate tissue. They'll start breaking. They'll break. So in such cases, right, what really happens is that sometimes when we write the report, we just say BVM plus plus plus. What's that? Bronchovascular markings, they are seen very prominently. Now, if you really take the X-ray chest, right? If I just draw the X-ray, if we just draw the X-ray chest, right? So these are the lungs. You will watch. This is the hilum. From hilum, all those bronchovascular segments, right? They are seen. On right side, there are 3 lobes, left side, there are 2 lobes, but there is third lobe, lingual lobe also. But when you really see the X-ray, properly exposed X-ray, you don't see the bronchovascular markings on the outer 1/3. This is what is called as the outer 1/3. In this outer 1/3, there won't be any bronchovascular markings. So thus, all the bronchovascular markings, they will be seen in this area only. This outer 1/3 should be crisp clean. Right? But when the bronchomuscular markings are seen even in the outer third, immediately we say that the thing is chances of pulmonary hypertension is high, because from the right ventricle via pulmonary trunk, the blood is really pushing with so much power that it is even expanding, and it is seen, its effect is seen even over here. And then comes the system of all those curly lines, A, B, etc., right? Parallel lines, which are like a septa. It'll come later, but there are some clear signs. So that's what is called as the prominent bronchovascular segments, not segments, markings. So there is so much into this, but that's the marvel of fetal circulation. Okay, so the homework. So 101, 102, including me. The homework is very simple. You have to write a love letter to yourself. Now, don't be in a hurry. You have to write. You don't have to type physically. Paper, pen leke baithna. And before that, think of it. Think about yourself. The letter should be so good that you fall in love with yourself. This is one of the best thing for self-confidence. Seriously, I know हंसना आता है.
घर वालों ने पढ़ लिया तो
किसी ने पढ़ लिया तो क्यों है ऐसा? लव लेटर को ऐसे पब्लिकली थोड़ा ना देख छुपा के रखते हैं ना.
Sir, in Indian homes,
What is
privacy
the
is a
fetal
myth.
lung? Fetal lung, Sakshi, fetal lung get their oxygen. Fetal lungs, they get oxygen via arteries, right? Capillaries. वहां से जाता है oxygen. But there is the difference between, I mean, this is a good question. So here is the lung. Lungs को blood कैसे मिलता है? Lungs, they get the, again, same concept of salary, right? So there are pulmonary vessels, and then there are bronchial vessels. Bronchial vessels which are coming from aorta, right? So their function is, इसको खाना पीना दो, salary दो, so they give oxygen. Bas, that's it. Pulmonary vessels will say, ये इससे काम लेते हैं pulmonary vessels, because they will be divided into capillaries and they'll say, लाओ oxygen. right? जो breathe किया, right? And ये लो पकड़ो carbon dioxide, and that is taken out. So this is for the gas exchange. This is for the gas exchange, and this is for the salary. Those bronchial vessels, they will trickle. वो जो वहाँ पे लंग पड़ा है उसको के लिए भी खाना ले जिंदा रहे, right? But these pulmonary vessels, they will be. That's why it's called as the hypoxic pulmonary vasoconstriction. It is not hypoxic bronchial vasoconstriction. Never. It is pulmonary, right? Good question. Quite thoughtful. Blue baby. Blue baby, pata hai? It is homework. And this was the homework. And last. What will be the test portion? Spurs. Test portion का ऐसा है कि जब तक मतलब थर्सडे तक जो कुछ भी पढ़ेंगे, that much would be the test portion. Right? This would be our all-time law. हाँ, blue baby ना, देखो, there is like blue baby, there is like pink puffers, pink baby, सब तरह के. This is left side, this is right side. Left side is oxygen. यहाँ से यहाँ blood गया, तो what would happen? The blood will go from left side to right side. अच्छा ही blood गया है ना. Good blood is circulating, so baby will be pink. कोई problem नहीं. When it goes from right to left, this is the carbon dioxide blood. वो जाके मिल रहा है इसके अंदर. That means the entire body is getting more carbon dioxide, so baby will turn blue, but not instantly. When the baby would cry, because when the baby would cry, right? So at that time, the circulation will increase and there will be more deposits of carbon dioxide, and then baby would turn because it is straining, right? And that is something what is called as the Valsalva maneuver. So in that, all these mechanisms would come. But basically, it is like carbon dioxide which is getting pushed into a good circulation, and that is turning the baby blue. Because normally it won't turn blue because oxygen hai to sahi, but when the baby is straining, right, the oxygen is insufficient, so it will start turning blue. And when there are multiple tetralogy of Fallot, it is called as the TOF, tetralogy of Fallot. So it means when there are multiple, there are 4 abnormalities which are occurring together. Right? Now, isolated atrial septal defect can occur, ventricular septal defect can occur, overriding of aorta. Overriding of aorta means aorta. Imagine how dangerous would it be. Instead of left ventricle, it is coming out from right ventricle. Aorta, right ventricle. That means from right ventricle, the blood is pushed into the aorta and then to the entire body. Right ventricle में तो क्या है? Right ventricle तो is having carbon dioxide blood. The baby will turn blue. So these are all coming under congenital heart disease or congenital heart anomalies, right? So that would be the foundation of everything. Regarding this love letter, why I'm telling is कि पूरा दिन सोचना. What are your best qualities? Things in which you are so good. And write it bindas. This is one of the finest thing to increase your self-confidence. Increase your self-confidence and self-love. Because unless and until you don't love yourself, you won't progress. Right? वो negative चीजें आती रहेगी. दो मैंने आपको ईमेल में इतना डिटेल में लिखा, but still it happens like घूम फिर के वापस वो दिमाग में आता है. There is nothing wrong in it, right? It is okay. And I'm happy that you have written it in so much of detail, that I appreciate. So do this thing, because then and then you will be knowing that you are like a gold. Yeah. So do write it. छुपा के रखना लेटर. लिखना हाथ से लिखने का क्यों? Because when you write it with the hand, that feel is completely different. वो typing में वो मजा नहीं है. Right? When you write it with your hand, it's a great thing. All right. So thank you so
Sir,
much. Huh?
sir, is the belly button appearance dependent on how we cut the umbilical cord?
Yes, that's right. That's right. Though there are few conditions in which it becomes everted. Instead of inverted, it becomes everted.
Yes,
Right?
sir,
When the
that's
internal abdominal pressure rises, or when there is umbilical hernia. Umbilical hernia is when the intestinal contents they start coming out of the umbilicus, or when there is some malformation of the anterior abdominal wall. So then also the appearances they change, and if the surgery is done, but still the scars and everything they remain over there. But that's right. As such, in general, it depends on that, and say many of the cosmetic surgeries they are related to umbilicus when they wear those type of say clothes. So they want that their umbilicus, and even they go for the piercing at umbilicus, which is like in fashion. Okay, so thank you so much, and
Thank you.
take care.
Thank you.
Wish you
Thank you,
Thank you, sir.
Thank you,
Thank you,
sir.
sir.
a lot.
sir.